I'm currently working in a med-surg tele stroke patients, and my ratio is 1 to 4, 1 nurses to 4 patients. I've always go through this checklist. It's a guy helping me to feel grounded at the beginning of my shift. If I have all of these questions answers, then I'm good and I can move on taking care of my patient. So let's get into it. First thing is the cheap complaint, which is literally meaning why the patient coming to the hospital. Did they have a fever? Did they have a cough? Or are they ultra mental status? That's just a quick cheap complaint. Get to know why they're in the hospital. Next thing is the diagnosis. You can literally find it in the chart. Are they here for acute respiratory failure? Are they heart failure? Are they here for stroke? Or are they here for whatever, ultra mental status, you know? It can be a diagnosis. So that's, you know that, okay, they are here and we are treating them with this diagnosis. And then for the history wise, I don't really pay attention much because some patient has a long list of history, maybe 20, 30 history. I pay attention to the most important thing, which is, are they diabetes? So if they are diabetes, you do sugar check on them, right? Like before their dinner or before their breakfast, whatever. If they have history of cancer, especially if breast cancer, like remove, sometimes you cannot use the right arm or the left arm. Those are the history I want to know. Other than that, that's fine. Next is GCS, neuro wise. Are they alert oriented time 4 or are they alert oriented time 2? Some people 0. They don't know who they are or what the heck happening with them. So I want to know that. Some hospital use Glasgow coma scale, which is 15, 14, 13 and so on, so you get used to what system you want to use. Next is the oxygen. Are they on oxygen? If they are on oxygen, how many liter? Are they using nasal cannula or high flow or BiPAP or CPAP? All of my patients are on tele, so I want to know what the rhythm they are in, especially if they AFib. If they are AFib, we don't want them to go to AFib RVR, which is 140, 150. It's not good. The heart cannot bump and it's bumping so fast. I always pay attention to that and making sure that we already treated or we have medication PRN if we need it. Next is GIGU. Are they continent? Which means they know when they're gonna go pee or when they're gonna go poop. If they are incontinent, they don't know. When they don't know, how are they gonna go? Do they have a Foley or do they have an external catheter? Those I want to know. And then moving on to that is gonna be ambulatory. Are they walking or are they using a walker or are they using a cane? If the patient fell and then something happened to them, it's causing you a lot of trouble. Know how they ambulatory, also very important. Next is the skin. Do they have any wound? If they have any wound, do you have to change their dressing or how you gonna do that? Know if the skin is intact or not. Next is blend. Blend is hit or miss. If the patient just come in a couple hours or even less than a day, they won't probably have any blend. They just there because we just need to gain more information for us to treat them. It's just hit or miss, but you still want to know, are they gonna go back to their home or where are they gonna go next? That's kind of the blend I'm talking about. And then I'm gonna look at the lab. I will pay attention to potassium, creatinine, and hemoglobin. These 3 I'm always pay attention to and making sure that they are within the range. And if they are out of the range, then what do I need to do? Because sometimes when hemoglobin is low, you have to do some blood transfusions. Have a look at the lab. With that being said, that is all I'm going through from top to bottom. Is literally 10 things that I go through every single patient of mine, and as you get used to this, you're gonna develop a system where you know, okay, what next, and then this is gonna help you go through your report efficiency faster. I hope that this video helped you and I will see you in the next one. Bye.